a kitty. All right, folks, as you surely know, Cliff and I both come from healthcare. Cliff is still in healthcare. I don't do that anymore. So we have some kind of pointed opinions on everything that's going on with this COVID business. But beyond the pandemic that is COVID, we need to talk about the handling of crises, the management of emergencies by the administration, by the people charged with managing the conduction of the hospital system, the healthcare system, that is inevitably a for-profit system. We are in the midst of a pandemic, as you surely know, and our very own Cliffy has some pointed opinions about what is happening, especially at his hospital. I'm not going to repeat what he says. What I am going to say is, if you are a healthcare worker, if you're a frontline healthcare worker, or even an ancillary worker in any capacity, a grocery worker that has to deal with the nonsense that is hoarding of toilet paper, that is COVID potential possibility, positiveness, yuck, we want to hear from you. We want your stories. We can keep you anonymous, so contact us. Contact wdtw@gmail.com. Reach out to our Facebook page. Hit us up on Twitter. We want to hear from you.
This is Cliff Wilming with We Do the Work. We wanted to check in with everybody after this week. Obviously, it was crazy on a number of levels, and we don't really want to get behind on these issues. Tomorrow I'm going to be starting into a few shifts in the ER during the course of all of this mayhem. And we wanted to go through a few ideas with everybody that kind of follows We Do the Work. If you're new to us, welcome. We are a union, rank and file run, independent podcast. You can check out our mission statement on our website at wdtw.org to get kind of a sense of our perspective. But, the long and the short of it is, we want to come at issues in a way that speaks from the perspective of actual frontline working people, which is sometimes one of the most missing elements in the American narrative. This entire issue with coronavirus and the strains it's now putting on the entire U.S. system is really ramping up. I'm sure I'm not the person that informed you about that. I wanted to talk a few things. For one, we had started into a longer series about the closure of St. Joe's Hospital, the cuts to bed at Bethesda, and I understand that they're now trying to make a lot of those spaces at Bethesda into negative pressure rooms. And I want to talk a little bit about how hospital administrators are handling this, and what the real experience on the front line is like. So, for the last 3 days, I've had off, which is almost, it's almost more unnerving being outside of the ER right now than being on the inside of it, because you're left to speculate and read thousands of text messages and try to organize a response. And you're going to hear my dog here. He does this all the time. Try to organize a response from an administrative layer of healthcare that really is woefully and inadequately prepared for this type of event. They are bureaucratic. The CEOs, as you would imagine, are primarily motivated by, a cultural phenomenon of self-interest. And, we've got some major issues going on. And for one, I want to say that I'm speaking as an individual RN, and as a member of We Do the Work. I'm not trying to represent my union, Minnesota Nurses Association, certainly not representing Allina Healthcare Systems. But I can say this, and I need to say it because part of our nursing license requires that we advocate for our patients. And part of advocating for your patients means giving the community the information that you need to be aware of your surroundings, and in a way that is not packaged to make one administrator or CEO look better than anybody else. In other words, we believe that given the information, you can make some decisions that are of relevance to yourselves and your family and that sort of thing. So unlike ZDogg MD, I'm not going to be geeking out on the medical details right now. I will say that the cost-cutting measures and the cut corners of administration are starting to be implemented now. So at first, it was quite clear that coronavirus was airborne, meaning that you had to have a N95 respirator mask. A hood is another option for that, as well as contact precautions because it would be in the air. as of today, people in the ERs and across the hospital systems are being told that they should no longer need to use airborne precautions if they're not handy at the time. And this changes things drastically because you go from an N95 respirator down to a little surgical mask that does not help for airborne precautions. So in the vacancy left by hospital administration, who is not telling us their staffing plans, how to staff up, who is not telling us how many respirators we have in the hospital, and a few other examples of what was described by one nurse as, quote unquote, like talking to a brick wall. We are seeing the friction between these two elements, the bureaucracy and the real frontline workers, ramp up. Which is extremely frustrating on levels that I couldn't even begin to describe right now because they have to do with the health of our frontline healthcare workers, but also the patients and their families and all of that kind of thing. So imagine the pressure working under those conditions with an administration that is quite comfortable just ghosting us. So the good news is, and I think that this happens in many catastrophes or moments like this, is that the frontline healthcare workers are no longer trying to make a moral appeal to management. We've started to organize ourselves. The stewards, which are kind of the low-level platoon leaders in unions that have up to this point been almost totally underutilized, are now organizing ourselves. And it starts to sound less like us asking administration for something, and it's starting to feel more like we're telling them what we need immediately. Making public statements on this is contentious because, as some of the union staff will remind us, hospital administration is not beyond creating punitive measures for people that speak out in a way that might advocate for patients and their families and the health of both, but that might not portray administration in the light that they would like. And to that, I have to say that I'm willing to take that risk personally. It's not an uncalculated risk, but I have to. For one, I'm morally obligated to tell you folks the truth. And, maybe I should do a Facebook Live and you guys could ask me all kinds of questions. But there's another element to that calculation that right now, frontline healthcare workers are the most direly needed people in the United States. I mean, outside of the supply line chains and all the rest of the working class that allows us to perform the work that we do, we're the ones that you're coming to when you're having shortness of breath. You're certainly not going to the CEO and asking him to set up an albuterol treatment for you. And so right now, even though we're working under the most stressful conditions I've ever experienced, the power of our position means that we can do far more advocacy for our patients and be far more demanding on administration than we priorly have. And if there's one thing I hope can come out of this moment is that people like me and the other workers that I'm with every day, and I'm talking about the techs, and I'm talking about housekeeping, and I'm talking about everybody else that actually makes the hospital run. If we could start collaborating with the community and exchanging information in a way that is not filtered through bureaucratic channels, I believe we could build a powerful moment to start addressing the community directly and start to build what actual public health care could look like. In other words, a dialogue between the community that we serve and the frontline workers that are there. Within all of that, of course, we've got the supply line. And don't get me started on how successful that corporate model was that shipped our supply lines for drugs and protective equipment halfway around the damn globe. We won't have to pay much attention to that. None of the media is actually paying attention to that, so don't start now. But I'll wrap it up there. I know that this is kind of a burst of information. I want to do this moment the greatest justice that I can. I don't want to cringe from it, although I have to admit it can get a little scary. But we've got to, those people, those of us, the 99% that have been given a lot of lip service by politicians over many decades, now's our time to step up. These are the moments where you will see real leadership ingenuity, and initiative. And I do want to send a special warm thank you to everybody that I work with, the We Do the Work crew, and especially all of those folks that I'm going to be hanging out with in the ER tomorrow morning. So hopefully I'll come refreshed and highly caffeinated with all my inappropriate jokes like I normally do. And let's do the work.